Governor Abbott announcing Thursday that nursing homes and senior living facilities will once again be allowed visitors, but still with a few restrictions. KLBK's Grace Moore spoke to the family of one nursing home resident. Grace, how are they feeling about the news?
Terry, while they are excited about the possibility of getting to see their loved one again, they say they're cautiously optimistic as these new guidelines are voluntary. But they say for now, it's a step in the right direction.
Governor Abbott announced new guidelines for senior living facilities, lessening restrictions on visitation even further.
One of the hardest things with COVID was the initial shutting down of our nursing facilities. To be separated from your family, visiting through a window is not the same.
The new guidelines allow nursing home residents to designate 2 essential caregivers to visit them. These caregivers are not required to social distance, but are only allowed in one at a time and must go through special training. Mary Nichols' mother is in a nursing home, and Nichols started a petition back in June calling for the governor to allow in 1 essential caregiver. Her petition now has over 23,000 signatures.
We asked for an essential caregiver, and that's what the governor said.
Nichols says she's cautiously optimistic because nursing homes can choose whether or not to adopt these new guidelines, but she's still hoping to be able to see her mother, who she hasn't seen in around 6 months.
Should be able to go in as her essential caregiver and see her. However, it is going to be, I believe, totally and completely up to my mom's facility.
In Lubbock, there have been nearly 50 deaths linked to COVID-19 in our nursing homes, and Wells says those essential caregivers need to make sure they're being safe before visiting their loved one.
I mean, there's always a risk whenever we start bringing groups of people together. For families, they're going to have to make that decision with whether or not they can be safe outside the nursing home so that they don't bring it into their loved one.
Both Wells and Nichols are hoping that by allowing visitors, it will cheer up those residents in isolation.
Being able to touch people again, to be able to hold somebody's hand is all good for our mental health.
I am hoping that this has a positive effect on the health and welfare of those residents.
And while Nichols is unsure if she'll be able to see her mother, for her, this is a step in the right direction.
Any movement toward getting visitors to their loved ones is a good thing.
Those who are not essential caregivers can still schedule outdoor or socially distanced visits with their loved one's nursing home if that nursing home allows it. These guidelines are effective September 24th, and we reached out to several nursing homes in the area to see how they were planning to deal with these guidelines, but none were available for comment. Terry?